Hey everyone, good day to all. So guys, this is going to be the part 2 of our 150 plus topics discussion for the FMG. Okay, so guys, see here, this is going to be the part 2 and the for the PDF, guys, the link in the description, or else you can just type the FMG aspirin that is more and Telegram you can get from there. Okay, let's start the next topic is guys all about the so guys I don't want to waste any time. Okay, just directly we have to focus on the important topics. Okay, now then see this is the STDs guys. The bacterial. See you have the bacterial infections STDs guys. First one is the guys bacterial vaginosis. Guys, is a bacterial vaginosis. It is caused by Gardnerella vaginalis. Caused by Gardnerella vaginalis. Okay, remember guys, in the bacterial vaginalis, bacterial vaginosis, what you have to remember is there is a M cells. There is a M cells criteria. There is a M cells criteria. What are these criteria? Includes it is a grayish white discharge, grayish white discharge, and a fishy odor. This is the what? Fishy odor, fishy odor, chapalanti smell. Okay, okay, here fishy odor due to what? Due to release of amines, acridine, and pyridine. There is a which is called as whiff test positive, which gives whiff test positive, which gets whiff test, which is called as the whiff test. If it was given the fishy odor, it is called as the whiff test. Okay, and also there is a last one is the clue cell. These are the clue cells, guys. The vaginal epithelial cells loaded with the organisms. Here, this is called the clue cells. See how they are going to ask the questions from the bacterial vaginosis, guys. See, most of you guys just remember the clue cell, fishy odor, and the it is caused by Gardnerella vaginalis. But see, there is a chance to ask the okay in the bacterial vaginosis, the fishy odor is due to what? Due to release of amines. Okay, and then guys, they just give these image, and you have to find what the diagnosis. It is the bacterial vaginosis. Done. Yeah, some and also they will ask the what is the pH of vagina. It is the more than 4.7. More than 4.7. Okay, it's required. Okay, now and he see what is the treatment. We are having the first is the metronidazole. Most of you guys just remember the metronidazole only. But you have to remember we are having the two other drugs, example, clindamycin and the tinidazole. So these are also the drugs used in the treatment of the bacterial vaginosis. But the main is the metro. Okay, next coming to the trichomonal vaginitis. Guys, for this, remember this is my one way of style. To remember this one, guys, see here. This is the waterma. This is the strawberry. This is the strawberry here. These are the green leaves. Okay, it means what it indicates. It means, guys, there is a strawberry cervix, and there is a greenish discharge. There is a greenish discharge. Remember like this one, guys. See, I went to buy strawberry via metro. I went to buy strawberry via metro. What is metro here? Drug of choice is the metronidazole. Okay. How does metro is moving? Like this one. It means the protozoan, trichomonal vaginalis is moving like okay na. Like this is having that what twitching motility. Okay na. Since the strawberry is very costly, okay na, that's why no one will afford this price. That's why it is culture media is the diamond media. Okay na? Done. Okay. The next one is guys, see here. The treatment is the metronidazole. And remember here, you have to treat the partner also. You have to treat the partner also. Remember, remaining three, no need, but in the trichomoniasis, you have to treat the partner also. And next one, guys, coming to the candidiasis. See, all are D. Candida, Candida, Curdi. Candida, Curdi. Remember, guys, here the pH must be less than 4.5 here. See, Candida albicans, there is a curdy or cheesy white discharge. Okay, the drug of choice is the fluconazole 150 milligram. Fluconazole 150 milligram orally. Okay, I think it's clear. Next one is guys. Okay, next one is guys the types of seizures. The first one is the GTCS. The first one is the GTCS, generalized tonic-clonic seizure. Generalized tonic-clonic seizure. It is most common in young adults. Okay, na? That's why it is called as grand mal epilepsy. Grandma means what, right? More is there. It's not children's, not in adults. Okay, that's why it's called as grand mal epilepsy. See how it occurs. See GTC here. See, suppose example, I'm eating. Suppose example, I'm eating in someone's marriage. Suddenly, I just fell down. I having the loss of consciousness. Just fell down and just like this, I will get tonic clonic movements. Yeah, this is a salivation. There is a more salivation. There might be the chance of the tongue bite also. Okay, na? Tongue bite also. See there, first of all, is there going to be the patient will fall down. Okay, fall down. Second stage is the all muscle will go into contraction. Like this one. Okay, now there is a 10 teeth clenched tongue bite. Okay, now suppose example see here, guys. Suppose example, I'm the patient who just fall down because of the GTCS. So what you have to do? You have to do first of all you have to remove all the risky substances from my side. Okay, now so you have to make sure that the environment is what safe. Okay, there is no more any sharp objects. Okay, na? And then after that one, guys, you have to after the seizure ends, you have to turn the patient toward the left side, like this one. Okay, na? Because the patient is still like this one, guys, because the more salivation, the saliva will go into trachea and it will cause the aspirate pneumonia. Okay, that's right. See, here this is the next one is the third stage is the all muscle contact and relax multiple times. The nausea, vomiting, headache, confusion, amnesia also. What happened? Nothing. Question समझ में आएगा उसको. Okay, so guys remember if the GTCS, I think you guys saw the movie Raja Rani. Nantara is having the GTCS. See here, if the GTCS continued more than 5 minutes, then it is called as status epilepticus. It's called as status epilepticus. Remember, guys, if the GTCS is more than 5 minutes, then it's called as the status epilepticus. Remember, for this one, guys, you have to give the drug of choice for this. It is the IV lorazepam. It is the IV lorazepam. IV lorazepam or IV phenytoin or IM midazolam. Okay, midazolam. Remember, this is the main drug of choices. Lorazepam. Multiple times they ask in the exam. Remember here, guys. For the GTCS, the drug of choice is the what? The drug of choice is the valproate. Actual treatment of the GTCS, it is the valproate. But valproate is very teratogenic in pregnant women because it causes the NTD. This is neural tube defect. Causes the neural tube defect. Suppose example, I am the female who is diagnosed with the GTCS, and I know that the drug I'm using right now for the GTCS is the valproic acid. It may cause the harm to my baby if I am going to pregnant. That's why I have to go to the doctor and I have to tell that doc, I want to get the pregnancy. I'm planning for pregnancy. I want to change the medication. You know? See, for that female, guys, you have to, if the female wants to get pregnant, then you have to stop the valproate acid and use the levetiracetam or lamotrigine. Okay, levetiracetam is the best one. See, if that woman don't know anything about that one, okay, and she keep on taking the valproic acid during the pregnancy also, then guys, you have to tell, please continue the valproic acid and add folic acid 4 mg per day to compensate. Okay, done. Next one. So the guys, next one is the see here. This is the types of see is the infantile spasm or salam seizure, or also called as West syndrome. See, guys, the children will say like this one, like this. So you listen. It means salam, salam alaikum, salam alaikum, like this one, like this. See, muscles goes into contraction spasm, that is flexion, and is in a jaw and knife position like this. Okay, that's why it is called as salam seizure. Also, it is called as infantile spasm or West syndrome. If in the EEG, you will see there is a hips arrhythmia. What is the drug of choice? Is the ACTH. Is the ACTH. Next one is the Jan syndrome. Jan syndrome, also called as myoclonic epilepsy. Jan syndrome or myoclonic epilepsy. It is the for this one, guys, they will give the history of there is a sleep deprivation. There is a history of sleep deprivation whereby when it occurs in during morning. While wake up, there is a sudden bilateral myoclonic jerks. Okay, on the EEG, see the polywave and the spike or polyspike pattern here. Remember, guys, for Jan syndrome, myoclonic epilepsy, they'll give the history of morning spike. Okay, just remember the drug of choice is the valproate. If there is if there is no valproate, then you have to give the lamotrigine. Okay, the next one is the subtle seizure. Just they will ask the what is the most common type of seizure in what is the most common type of seizure in unit? Then you have to mark the answer right. It is the subtle seizure. Okay, now subtle seizure. What is the drug of choice? It is the IV phenobarbital. IV pheno. See, this is the one. This is the newer. This is the what? Neonate. Neonates means less than 28 days. Means approximately 1 month. 1 year. One also. See how to remember the IV phenobarbital. Remember, this is the febrile seizure. See, febrile seizure. What are you do? In episode of what? Episode of fever. Okay, na? This is the febrile seizure. Most common in where 6 months to 6 years. Episode of fever. The drug of choice is the rectal diazepam or IV diazepam. For the prophylaxis, you have to use the clobazepam. Okay. Next one is the absence seizure or petit mal seizure. Means school going children. See, they will give the history of that. A patient is having the poor academic performance. History of poor academic performance, and she getting the blank staring episodes. Few seconds. Like this one. The child will look like this. Hey Ajay, the teacher. Ajay. He will not get any response. Okay, he'll be unresponsive. That's why he will get the low academic performance. For this one, guys, remember, guys, the drug of choice, if the patient is less than 5 years, then you have to give the ethoxyzamide. It is ethoxyzamide. If the patient age is more than 5 years, then you have to give the valproate. Okay, then next one, this is the guys stroke. Coming to the stroke topic. Okay, so guys, in the stroke there is a B C D 2 score. Okay, what does A means, B means, C means, D means what? That's what this is the also a question asked in the exam. A for age. Age must be more than 60 years. BP must be more than 140/90. Clinical features like speech difficulty, and there is a unilateral body weakness. This is the duration, and this is the diabetes mellitus score. Okay, remember this is the ABCD full form. And also, guys, please remember there is a one question. This is the transient ischemic attack. Okay, transient ischemic attack. Okay, see, there is a sudden non-convulsive focal neurological deficit. Okay, lasting more than 24 hours. Okay, now see, if there is a recovery within 24 hours, it is known as TIA, transient ischemic attack. If it is recovered within 72 hours, then it is known as the reversible ischemic neurological deficit. Okay, remember, guys. Here, see how you are going to manage. See, guys, if it is the hemorrhagic, if it is hemorrhagic, first of all, you have to lower the BP to less than 140 by giving water, labetalol, labetalol, labetalol is the labetalol, is labetalol. Okay, if it is so, guys, if it was ischemic, you should not lower the BP, okay, na? Should not lower the BP because decrease the blood flow. Because it will decrease the blood flow to the brain. Only decrease the only decrease the BP in case of if there is a water, there is a more than 220. The BP is more than 220 out of by 120 mg by giving water, CCB or labetalol. Okay, when to lower if the BP is more than 220. Okay, then only. And also, guys, remember this one can use thrombolytics, but best time is the within 3 hours to 4.5 hours. Within 3 hours to 4.5 hours only you have to do the thrombolysis. Please remember, Rababure, very very important. Okay, within 3 hours up to 4.5 hours. For thrombolysis, guys, make sure that the patient BP is less than how much? 185, less than 185 to how much? Diastolic is 110. Okay, got it. Done. Remember here, for thrombolytics, you have to do within 3 hours to 4.5 hours. For the thrombolysis, you have to make sure the BP is must be less than 185 by 110. And for the you have to decrease the BP when if the BP is more than 220, then only you have to decrease the BP by giving what? Labetalol. It is the labetalol. Done, done, done. Next one, guys. Next one is the Myasthenia gravis. Is the Myasthenia gravis. Myasthenia gravis. Myasthenia gravis. See, see, this is called the ptosis. This is the ptosis. Remember, guys, there is a two situations here. This is the what here? This is the Myasthenia gravis, and there is a Lambert-Eaton myasthenia syndrome. First of all, tell me, okay, tell me about the Myasthenia gravis. I think everyone knows about the Myasthenia gravis. There is a ptosis, there is a muscle weakness. Everyone knows. But can you tell me what is the most sensitive test for the Myasthenia gravis? Everyone tells it's a edrophonium, edrophonium, edrophonium. Arey, apara babu. What edrophonium, bro? Please read the question carefully. What they are asking, they ask what is the most sensitive test for the Myasthenia gravis. Then the answer is the EMG, single fiber electromyography. The most sensitive. The diagnostic. What is the diagnostic test? What is the diagnostic test? It is the edrophonium or tensilon test. If you give this one, the symptoms will be improved. This is diagnostic edrophonia. For the most sensitive, it is the single fiber electromyography. Please remember this one, Radhe. Okay, now remember. And they will also ask you what type of hypersensitivity reaction is this? What type of hypersensitivity reaction is this? This is the type 5. Actually, see guys, here listen carefully. If in the option there is a 2, 4, 3, 1, then you have to mark the answer is 2. If there is both 2, 5 in the option, then you have to go with the 5. Okay, now. Okay, now. If there is an option like 5, 2, 4, then you have to mark the 5 only. Don't mark 2. I will prioritize 5. Remember, guys, here. See what happened here. This is the what? This is the presynaptic. This is the postsynaptic. Okay, na? This is the pre and the postsynaptic. What happens here is that see while coming to the Myasthenia gravis, there is autoantibodies. They are attacking what? Where? Postsynaptic. What? Postsynaptic acetylcholine receptors. Okay, autoantibodies attacking to where? Postsynaptic acetylcholine receptor. That's why see here. See. But while coming to the Lambert-Eaton myasthenic syndrome, guys, what happens here? Autoantibodies are going to attack on the calcium channels. Whereas at the calcium channels, that's why there is a less number of what? There is less number of acetylcholine. Acetylcholine. That's why there is a see. If there is no calcium, then how come these acetylcholine will release? See here, what happens here is that all the auto antibodies came and they closed this. They closed this surface. Okay, they close their opening. That's why see here most of the anticoagulants here they are waiting. Oh my goodness, someone is taken my place here. But what happened here? They block directly the calcium channels. Without calcium channels, how come the ACH will release and they're going to perform the work? This is the how that is the what the happening in the Myasthenia gravis and the Lambert-Eaton myasthenia. Remember here, so this is what happens. So most common is the myasthenic. Remember here, just draw all this one. Here in the Lambert-Eaton, there is a proximal muscle weakness, autonomic symptoms like dry mouth, constipation, and impotence also. And remember, this is associated with the thymoma. This is associated with the small cell lung cancer. This is the reversible. This is the minimal effect while giving the ACA studies. Okay. Remember, what is the management of the Myasthenia gravis? Remember, for the mild, you have to give the pyridostigmine. Pyridostigmine. It is the best one. If there is no, if it was not in the option, then you have to mark the neostigmine because this cannot cross the BBBB blood-brain barrier. But this guy is crossing the blood-brain barrier. Okay, that's why you have to prefer the pyridostigmine. For severe steroid, for the myasthenia crisis, IV, IG. Cause of death, renal failure, surgery, thymectomy. Okay, na? Hey, please do not make any mistakes. Okay, ఒక क्वेश्चन वस्तది एक क्वेश्चन जरूर आएगा इसमें से ठीक है गलती मत करना भाई okay guys see this is my favorite topic this is the anti-TB drugs it's the TB drugs this is the TB drugs as from the TB drugs they are not going to ask you uh what the hell of the this mechanism of action and when to use this one. They will just ask you about their side effects. Okay, now there is a new TB drug is added. I will tell you in the PSM. I think in the last session. Okay, remember guys. First one is the ask the question is the what is the statement false about the bedaquiline. Okay, see remember here. See bedaquiline it causes QT prolongation. Yes, see, bedaquiline, see, queen are always cute. Queen are always cute. Oh, cutie. See, quilin, what happens? Is a QT prolongation. Quilin, what are? See, bedaquilins are QT prolongation. Okay, good, very good. Next, is recommended for the what? Anti-TB. Yes, obviously. It inhibits what? ATP synthase. Okay, na? It inhibits what? Adenosine. Okay, na? ATP synthase. ATP synthase. Good. Side effects include peripheral neuropathy. No, it's the isoniazide. Okay, this is the wrong one. Remember about the bedaquiline. Bedaquiline. What happens here? The side effect is the bedaquiline. Tweet ga. Okay, QT interval prolongation. It is the mechanism of action is the ATP adenosine triphosphate synthase inhibitor. Okay, remember this one about the bedaquiline. Next one coming to the isoniazide as a H. Isoniazide means it is denoted as H. Okay, na? See, isoniazide. See, hi. H. This is the C. I for isoniazide. Okay, now see, this is called a HR. This is called a HRZ. This is called HRZE drugs. Okay, H means isoniazide. Hi, H high. Okay, now remember here, guys. Remember here, Ra. Please remember here. Wait, I will keep the charging. Okay, done. Okay, see, isoniazide. What is the drug? What is the side effect? It is the peripheral neuropathy and there is a B6 deficiency. Oh my goodness, is causing peripheral neuropathy and a B6 deficiency. Rifampicin, RNA polymerase, side effect is the urine. Is a red. RNA, red discoloration of the urine. Next one is the pyrazinamide. Wow, pyar. Oh, pyar. Okay, now see, pyrazinamide, Z. Okay. Pyrazinamide is the hepatotoxicity. Okay, now pyara. It's a pyara. He is a very toxic to the liver. This is the causes the hepatotoxicity. Remember, guys, it causes the water, increase the uric acid, and it causes the what? Gout. That's the joint pain. Next one is the ethambutol. Ethambutol. Remember, it causes the red-green blindness. Red E for eye. Blindness. What type of blindness? It is the red-green blindness. Then next one is the guys delaminate and a preto and it is the what? It is the mycolic acid cell inhibitor. It side effect is the QT prolongation. है ना? Guys, remember Rade, one MCQ Rade. Okay, na? Next is the anti-diabetic drugs. Anti-diabetic drugs. Remember here. So, one question is asked in the exam. Okay, see, this question is already asked in the last FMG examination and many initiate also PG also. Okay, remember here, guys, you have to remember this one, Rade. At least this one. See, there is a SGLT2 inhibitors. SGLT2 inhibitors, they causes what? They causes loss of glucose in the urine. Right? So suppose loss of glucose in the urine. There is more glucose, then what happened, Ra? There is more sugar on your home, in your home. You just throw it, throw it here. Then immediately after 10 to 15 minutes, there is a more what? Hands. Hands will go to that glucose. Sugar. That's why here the more increase of glucose in the urine, it causes what? Risk of UTI. UTI. Okay. Genital myocardial infection, foreign gangrene, weight loss. See, all these drugs are like in drugs. They are ending with the gliflozin. So dapagliflozin, empagliflozin is a AG2L inhibitors. Flow. What? Glucose flow, loss of glucose in urine. Done. More urine, more glucose in urine, more sugar, more ants, more infection. Done. Next one is the DPP inhibitors. DPP inhibitors. See, all the names of all the class of these drugs they are ending with the leptin. See, all the names of these class of the drugs are like a girl name. See, Sita, hi Sita, hi Vilda, hi Lena, hi Sakshi, hi Lena, hi Vilda, hi Sita. See, all the names of the drugs are like girl name only. But I like only Lena. Lena, I want you. See, Lena ko lena, okay? Lena ko lena. I will just choose only Lena only because Lena is very safe in the CKD patient. Okay, that's why the question asked which of the following is safe in the CKD patient is the linagliptin. Okay, see, guys, all these girls are having here. Okay, na? They like the DP. They like to change the DP always. That's why, guys, these are DPP4. These are DPP4 inhibitors. DP girls. Wow. Okay, done. Next one, guys, is the bigonide. This is what? Class of metformin. As you know, it is a AMPK activator because the non-hyperglycemic. Remember, guys, that's why, guys, see, metformin alone is not recommended because it causes the lactic acidosis and also the vitamin B12 deficiency. That's why, guys, you have to always combine with this drug, sulfonylureas. Okay. Remember, guys, sulfonylureas There is one side effect it causes the hypoglycemia. Oh my goodness. Ooh. That's why guys, sulfonylureas are always not given alone. That's why you have to use this is the non-hypoglycemic, this is the hypoglycemic. There's a compensated. That's why you have to mix this one. There's a gleamy one, gleamy two. This is what gleamy means. Geo means what? This is the glimperamide and metformin. Glimperamide is 1 gram, 2 gram, metformin 500. That's why you can see, you can check out your mother, father, anyone who are using this drug, glimperamide and metformin. Just check the drug. Glimperamide is there is a 1 gram or 2 gram. Metformin 500 milligram. Okay, if the patient is not if the patient is not controlling their the sugar levels, then you have to move with the glimi 2. That means glimepiride 2 grams and the metformin is 500. Otherwise, initially is the 1 gram only. Next one is the thiazolidinamide. Okay, so remember guys, this is the Pyqs. Remember guys, remember only thing is the thiazole. It is the risk of bladder jola what right is the bladder cancer. Okay, remember this is the GLP-1 agonist, example liraglutide. Okay, remember guys, it is the drug of choice for the obesity. And also guys, remember here, no need okay, remember this one more than enough. Okay, done. Next one, remember guys, here there is a dermatophytes. There is what? Dermatophytes. There is what? Trichophyton, microsporum, epidermophyton, try me. See, try me. Try me. Oh, what try? See, try means what? Try means what? 3. Pyqs, see, skin involves the skin head nail. See right here, remember that there is a epidermophyton. Fight. Your sister always will use their nails. This means what? Trichophyton nails. It means skin is common. Okay, now remember trichophyton is what? Involves nail. Remaining is microsporum. Only 2 skin head. Okay, now next good. Remember this is the PSC. Remember this is the Preeti Sharma channel. Okay, Preeti Sharma channel PSC. First trichophyton is the pencil shaped. It is the pencil shaped. Microsporum, it is the water mite, it is a spindle shape, and the epidermophyton is the water mite, is a club shape. This is what you have to remember. That's it. Remember these images are important. These images are important, and remember what this involves. That's it. These are the brachial plexus. These disorders, defects. Okay, brachial plexus defects. Remember here, this is called as Op's palsy, Klumpke's palsy, wing of scapula. Okay, remember guys, here, see this one. See this one. This is the Op's palsy. This is the Op's palsy. This is the Klumpke's palsy. Op's palsy. It is the injury to what? In Op's palsy, up palsy, it is the upper trunk, involve the C5, C6. Deco 5, Deco 6. C5, C6. Okay, na? C5, C6. Okay, it involves the, remember, don't remember this one. I will tell you. Okay, remember guys, this one. What are the causes? It is the birth injury. Shoulder dystocia. If the head is came, but the shoulder is not coming to the baby, and again you are trying. What happened? Shoulder will what? There is an injury to the nerve which causes the shoulder dystocia. Okay, na? Okay, for the shoulder dystocia, I will tell you about the how to manage this one in the OB/GYN in the upcoming days. Okay, see, arms will be adducted, medially rotated, guys. Elbow must be extended. So it is this is see like this one. And there is a forearm pronated, finger will be flexed. This is the called as police. This is what happened here. Okay, na? This is also called as policeman tip hand. Remember guys, here the clumsy palsy. It is the come. See, this is the uterine lower trunk. Nerve root is the C8 to T1. Remember guys, here see here. What nerve? See, clump is clump, clump, this is the ulnar and the median. Okay, what are the main nerves involved in the clump palsy? Clump. It is the ulnar and median. Ulnar and median. Rest of all these nerve branches to this one, this guy is of palsy. Just okay, remember the clump is ulnar median. That's it. Okay. This is the hyperextension at the MCP. This is MCP due to what? This is there is a lumbricals and the introsseous got paralyzed. That's why there is a hand. Okay. Remember this is the wanging scapula. This is wanging scapula. The scapula here. This is the middle side is going to what? More prominent. Okay, now what nerve? It is the long thoracic nerve. If they ask what muscle, it is the serratus anterior muscle paralysis. Done. Done. Next one is guys the hypertension drugs. See, hypertension drugs, guys. Remember, guys, the hypertension drugs are very important for us, but they will ask you very simple. Okay, suppose example, if the patient is having the diabetes, what you will do? What you will do? The patient is having the heart failure. Okay, what you will do? Okay, most of the time they are going to ask the hypertension pregnancy. Okay, see, guys, here hypertension drugs. First of all, guys, if there is only hypertension, but there is no other symptoms, there is no other problems, then you have to prefer the first మంచి drug ఏంటంటే అచ్చవాడ drug thiazide. Then it is ACE inhibitor. But mostly in the clinical practice, they are using the ACE inhibitors. It's the lisinopril 5mg. Lisinopril 5mg they are using. There is no other side effects, only the hypertension. You have to use the ACE inhibitors. So you use the thiazides. The drugs you have to use. There is no other symptoms. Okay. If the patient is with heart failure, you have to use the diuretics, ACE inhibitors, ARBs, beta blockers. You have to use. Remember, guys, beta blockers must be used continuously in a decompensated heart failure and are contraindicated in the in the cardiogenic shock. Okay, in the heart failure gas, you have to use Secubitril. This is the new drug. Okay, now when I was in the clerkship in Philippines, most of the patients they're getting the Secubitril. Okay, Secubitril. What give this is the this is the neprilysin inhibitor. Remember, guys, for the hypertension with the diabetes, guys, you can also give the ACE inhibitors or ARBs. In the nowadays, mostly they are giving the CCV, calcium channel blockers. This is the amlodipine, and also they are giving the ARBs. That is the low sartan. They are giving. Okay, remember. That's why I see here. See here, ACE inhibitors and the IRBs are protective against the diabetic nephropathy, but beta blockers can cause the mask hypoglycemia system. Next, hypertension, asthma. Hypertension है, patient को asthma भी है. You have to avoid the ARBs. Okay, na? But avoid the ARBs and the calcium blockers. No. So you have to take the ARBs and you have to give the calcium blocker, thiazide, diuretics, and only the cardioselective beta blockers. You have to avoid the non-selective beta blockers to prevent the B2 receptor induced bronchoconstriction. You have to avoid the non-selective beta blockers because it causes the bronchospasm. It leads to bronchoconstriction. That's why they increase the more asthma attacks. Remember, guys, you have to avoid the ACE inhibitors because what? Let me know. I will tell you about the ACE inhibitors in the next slide. Okay, remember here. See, so guys, for the hypertension pregnancy, the safe drug is the nifedipine, methyl-dopa, labetalol, hydrogen. I think everyone knows you have to contraindicate the ACE inhibitors, beta blockers, and ARBs. The patient is having hypertension plus BPH, it is the prazosin. If the patient is having only the BPH, you have to use the tamsulosin. Hypertension with gout, you have to use the losartan. You have to avoid thiazide because it increases the uric acid. So question. Remember here, these are the drugs, these are the ACE inhibitors. ACE inhibitor example, all are pril. Okay, they inhibit what? This is remember here, where you have to use the ACE inhibitor, they are using the heart failure mortality. Heart failure mortality. This one is very important. Heart failure mortality. This is the to prevent what? Heart remodeling. as a chronic hypertension. Okay, na? Most of the times they ask this question. Remember this one. ACE inhibitors cause what, amma? It causes the cough because of there is an increase in the bradykinin secretion. That's why you have to shift to the ARBS because of that if the ACE inhibitors are not suitable. Okay, now. And also, guys, ACE inhibitors are not given in the pregnancy also because it causes the renal agencies. Okay, now next one is the C. Next one is guys ARBS. Adenine receptor blockers. We are in the all the drugs are in which certain, candicertin, or certain. Okay, nama. You just remember the where you have to give the certain. If the patient is a diabetic, then you have to give this drug. Okay, which is hypertension, heart failure, proteinemia, or kidney disease. Okay, kidney disease, and also if the patient is not tolerant to the ACE inhibitor, then you have to give the ARBS. These are the main things we have to give in the for the these are the conditions you have to give the ARBS. Remember, for the calcium blocker, we have in the dipins, amlodipine, ifidipine, verapamil, and a dilidiazine. Remember, guys, here where they target L-type channels. Remember, guys, it helps in the hypertension, angina pectoris, arrhythmia, Raynaud's phenomenon. Remember, we have two types. We have in the dihydropyridines and the non-dihydropyridines. See, dihydropyridines used for the hypertension plus angina. Examples, amlodipine and ifidipine. For the NDH, that is non-dihydropyridines, it is used in treatment of the arrhythmias plus angina. Okay, side effect is the flushing, headache, dizziness, constipation. More with the verapamil. Okay, just remember these points from the. For the diuretics, I made a special video for that. Okay, na? I made a special video for that one. For the diuretics, okay, na? Don't worry about that. I will explain in the next video. Okay. Remember, we have in the total I already uploaded the 100 plus 100 plus one liners from the pharmacology. Just view it from the YouTube. Okay. There are some important drugs you have to master. Okay, na? You have to master. Okay, and this one, guys, this is the thyroid drugs. Remember, guys, in the pregnancy, in the first trimester, you have to give the PTU, means what? Propylthiouracil. The second trimester, you have to give the carbimazole and the methimazole. Remember, for the PTU, the side effect is the granulocytosis. Okay, now cytosis for the carbimazole and methimazole, the side effect is the watama. It causes the watama. It is the aplasia cutis for the hypothyroidism. Okay, na? The most common disease is the Gravis disease. Okay, na? See, in the emergency setting, if you want to manage the hypothyroidism, you have to keep this one 4 P's. This is the watama. It is the potassium iodide, propylthiouracil, propranolol, and the prednisolone. Okay. But hypothyroidism most commonly in the Hashimoto disease, and you have to give levothyroxine and the thyronine in the MCG. All MCG. Please, guys, remember the differences between the hyperthyroidism and the hypothyroidism. Okay, na? Please remember. Okay. In the hypothyroidism, there is there is a weight loss. You have to remember this value. See, hypothyroidism, there is a ulta, low TS. See, sorry, it is TSH. Okay. You want to know the differences. Okay, study this one. Differences. Guys, is the last one is the last one. So guys, so this is the plasma malaria topic. What they are going to ask in the exam is that, guys, from the malaria is the see, guys, in the first trimester, if the patient is diagnosed with the Plasmodium vivax, then you have to give the chloroquine. If the patient is diagnosed with the Plasmodium falciparum in the first trimester, you have to give the quinine. Give them what is the quinine. If the patient in the second trimester, you have to give the water, artemisinin. You have to give the artemisinin. Okay, got it? Remember, guys, here in the northern eastern part of the India, like Assam, what they are using? They are using these comments for artemether plus lumafentane. Okay, na? Just by heart the drugs. Rest of India, they are using artemis plus sulfodoxin, pyrithamine. Okay, na? For the relapsing, you have to kill the hypnozoites. You have to give the Watama primacune. For the cerebral malaria, it is the artesunate IV. You have to give the IV artesunate. As you know that primacune is a contraindicated in pregnancy. Okay. For the prophylaxis, guys, if a person traveling from the malaria endemic area to out, then person have to receive the drugs up to Watama up to 20 days. Remember here for the they are having the total thick and thin smear. For the thick smear for the parasite identification. For the thin smear it means for the species identification. Okay. Remember this one, guys. This is the Plasmodium falciparum here. Plasmodium falciparum. There is a there is a banana-like shape. Okay, there is a banana-like shape. Okay, we are having the Plasmodium falciparum. It is called as this is the Maurus dot. Is the Maurus dot. Guys, in the Plasmodium vivax there is a thick ring. There is a thick it's a ring like. It's called as the Scuffnus dot. Coming to the Plasmodium malariae, we have in the band like granules. Band like granules that's called as Watama Gemens dot. Remember, for this is the Plasmodium vivax. In viva they are going to shift the questions now. They are going to shuffle the question. That's why it is just Scuffnus dot. Okay, what is so falciparum? We read from the reverse M Maurus. Okay, band shape Gemens. Okay. Then next is the last one. Is the all over the poisoning here. Remember, first of all, I have to cover this one. See, this is the Datura. Or this is Datura poisoning. We have the sometimes they will call it as the suppose a person going somewhere from roadside. He ate from the roadside. He ate something from the roadside. Okay, or roadside plant. Also called as also called a railway road poisoning. Okay, it means they are asking about Datura. The atropine is what? Hyoscine and atropine. I think everyone knows about the hyoscine for the motion sickness. Atropine. Remember the 80s. All are DD, dry mouth, dry skin, dysarthria, dysphagia, all. Okay. And what is the physostigmine. This is lead poison. This is the Botulian. This is the Botonian line. This is the basophilic stippling. They will give this. They will give this in the history. In the image also. This is thallium. This is what? Thallium is always thallium alopecia. Thallium always what is the word? Alopecia. The alopecia, madarosis, there is no eyebrows here. There is a painful peripheral neuropathy. Cocaine, there is something sensation like in the acute there is a sense of well-being. Acute coronary spasm, bronchospasm, tingling, and a needle tract also is seen. In chronic there is a tactile hallucination sound. Something is running over the skin. See the color Magnus syndrome or cocaine bugs or formication. Okay. Next see this one. This is the stretchness poisoning. It is resembling to what? Resembling to tetanus. Okay. Which poisoning is resembling to tetanus? It is the stretchness poisoning. It is the Tonicus. This is the what? This is the Rhesus sardine or something. Okay. So remember this one. Remember this one opium. This is a triad. Triad for the opium is the triad for the opium? Meiosis, respiratory depression, and depression and the coma. Meiosis, respiratory depression, and a coma. Here the opium triad. Opium withdrawal, which is the rhinorrhea, diarrhea, yawning, and salivation. Okay. Next is cannabis, charas, bhang. These are the C. Cannabis, we have to call a ranamo. Killing spare. He will kill everywhere. Okay, now a motivation, there is increased heart rate, respiratory hunger. I must be conjugate is the most commonly abused substance is the cannabis. Active principle you have to know there is a burnt rope smell. Remember here the last one we are going to the amphetamine. There is an increased psychosis, seizure, suicidal thoughts. There is called as urine liquid draw. It's called the urine liquid draw because see some of the like so for example one of the guy is coming from the abroad and he just drank that one. He just drink the amphetamine. Amphetamine is unchanged. Amphetamine is unchanged in the urine. That's why after coming to India, he will just urinate it and just he will collect this urine and he will extract the amphetamine. That's called urine gold. Okay. If they give body packets and stuff first, you have to mark the answer. You have to mark amphetamine. Coming to the LSD, it causes the reflex, hallucination. Patient will seeing the red colors while listening to FM. There is a flashback. See, reflex hallucination. Patients seeing red colors while listening to FM radio, and there is a taking trip hallucination. Taking trip for hallucination. See, it will alter the changes in the vision and hearing, like a floating feeling and illusion, sense of synesthesia or seeing smell. Array, seeing smell and hearing colors. Okay, na? And also the individual becomes violent or panic stricken, or he or she may attack others as to kill or hurt himself. This is called as what? Taking the fascination. This is the what poison? It is the LSD, lysergic acid diethyl. So guys, if you want to study this about the all the poisoning, I also made a separate video about it with them around 30 minutes briefly. Okay, please try to study soon. Okay, guys, thank you very much. So meet you in the next session. Thank you very much.